Esther Sánchez, occupational therapist from the stroke unit at Hospital Universitari Vall d'Hebron, and I will explain you some of the most common challenges that a person can face after having a stroke. Dysphagia is the alteration in swallowing or the difficulty of the passage of food from the mouth to the stomach during feeding. Dysphagia can cause bronchoaspiration. That happens when the food enters the respiratory tract, and this could lead to pneumonia. Be alert if the person is coughing during swallowing. Some tips to keep in mind is to drink cold and fizzy drinks, as well as thick liquids, such as peach juice or a liquid yogurt, as they are easier to swallow. On the other hand, the position adopted by the person before, during and after the meal must be sitting down with his back straight and his neck slightly bent to facilitate the passage of food. It is also very important not to lie down after eating. It is not recommended to give foods that have a mixed consistency, such as soup with pasta or milk with cookies, nor to give foods that cannot be split, such as peas or rice, or foods that stick to the palate, such as lettuce and the loaf of bread. Another frequent alteration occurs in the field of sexuality. These dysfunctions can occur due to the injury or pathology itself. They can be secondary to clinical and/or psychosocial factors. Some examples of these alterations would be the decrease in libido and sexual desire, erectile dysfunction in men, alteration in self-image, and/or difficulties in lubrication, among others. Some tips to consider in these cases are to create a space of trust, respect the person's privacy, and/or ask for sexual advice. It is not advisable to self-medicate with drugs such as Viagra without first consulting your doctor, as in some cases it can be self-defeating. Finally, the alteration of the sphincters also occurs frequently in people who have had a stroke. The person might have an altered sensation of urinating or defecating, might have urinacy or fecal incontinence, or both, or might also have constipation, that is the decrease in the frequency of stool evacuation, or have hard stools. Some tips to keep into account would be to create a routine in evacuation habits, which means to go to the bathroom at the same times. Regulate the intake of liquids, especially at night in case of incontinence. Facilitate a safe environment and respect the person's privacy as much as possible. It is important to follow a suitable diet rich in fiber, vegetables and fruits, and also drink liquids so that the elimination is facilitated. It is advisable not to self-medicate with laxative or enemas without your doctor's authorizations, and follow his recommendations. For more information, you can contact the stroke unit via NoraChat.